Hi, this is Dr. Chumble from Northland Plastic Surgery. Let's talk about breast reduction surgeries. Signs that you might benefit from a breast reduction often become so routine you might stop noticing them. If any of what I'm about to describe sounds familiar, you're not alone and there might be a real surgical solution for you. The most common sign that we see would be back, shoulder, and neck pain that does not respond well to stretching, physical therapy, chiropractic care, or other measures of conservative management, including things like over-the-counter medications. The weight from your breasts might be pulling your shoulders forward to such a degree that your posture even changes over the years. Next, deep grooves from your shoulders from your bra straps. You might also have persistent rashes or skin irritations underneath the breast folds. Some folks have difficulty exercising no matter how supportive your sports bra might be. These add up over the years, and it's not just physical. Many women describe avoiding activities that they used to love. They describe not being able to find clothing that fits, and sometimes they might be drawing attention that they don't actually want to have. The emotional and lifestyle signs are just as valid as the physical ones. Many of these symptoms qualify breast reduction as medically necessary. Insurance will often cover a breast reduction if you have valid documentation that you've sought conservative management for some of the stuff that we've discussed, and you have to meet a volume requirement that is somewhat arbitrary but is often tied to what we call the Schnur sliding scale. Here's what surprises a lot of patients. The back and shoulder pain can improve within a few days after surgery. Sleep quality can improve too. The relief is one of the most consistent things we see. If any of this sounds like you, do schedule a consultation with us at Northland Plastic Surgery in Duluth. Relief is closer than you might think.